Welcome back to Midday Kentucky, everyone. Well, of course, we have the famous Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services here with two of his amazing patients and their success stories. Christina and Nikki, how are we both? Good to see you all again. Alrighty, I want to talk about gastric sleeving, which is what we had done. We're going to show a little video, Dr. Eric, of how it works. Explain to everyone at home what it is and how it works.
The easiest way to explain it's a restrictive procedure, so we're doing something to cause the patient to feel full quicker with less food. They absorb everything that they eat, they just feel full quicker. And so in a sleeve gastrectomy, essentially what we're doing is we're taking the stomach and turning it into a long cylindrical tube, almost like a banana.
Right.
The best way I can explain is what I tell patients is your stomach now is like a water balloon. You put it under the faucet, it's going to get 10, 15 times its size before it's completely full. And now your stomach's like a water bottle.
So
when the
this
water
is
gets
the
to
stomach
top,
that we're
full.
looking at?
Right, that's a normal stomach right there.
Okay, and you would put a sleeve halfway?
No,
or?
so there's no device that's placed in the patient. So we would staple off a portion of that stomach. I don't know if it shows that on the video, but we would staple off that large portion to the right and turn the stomach into the kind of the shape of a banana or a long tube. And so it's not going to stretch, it's not going to expand. When it's full, it's full. If you put a water bottle under a faucet, when it's to the top, it's full. As opposed to it dilating or stretching.
Can you, over time, you know, people have said in the past that, well, I put on weight after I lost everything. So can you stretch that out again by continually overeating?
No, if it's done right, if the surgery's done right, then the sleeve is not going to stretch. Your tool is always there. But here's what you have to understand. Let's take 2 water bottles and pretend that's 2 sleeves. In one of those water bottles, I can take a piece of grilled chicken and I can cube it up, and I'll drop those cubes into the water bottle and fill it to the top. That patient's full. The other one, I'll put it under a dispenser for a milkshake. I'll fill it up with a milkshake. That patient's full. One's going to lose weight, one's not. So it's how you use your tool, you know, and how you get full with that is how effective that's going to be.
Okay, so it's still about the content of what goes in the mouth.
Absolutely.
That's what we also have to remember.
Huge. You have to get full on the right foods, and that's what we spend as much time, if not more, educating patients about than just the surgery itself.
And let's just talk about that, the education after the operation and all the procedures. How was that for you? Were you expecting that to be so in-depth?
We were really impressed with how in-depth that him and his whole team, you know, explained everything before and after.
Yes.
We left there feeling like we knew everything that we needed to know, and then if there was something to arise that we may have missed or needed to know something about, then they were a phone call away. Still are.
Yes, absolutely.
So you had the operation how many months ago now?
5.
5 months.
Yes.
Let's bring up your before and after shots to begin with. So let's just start with this. Here you are. Now, how much did you say you weighed when you first took that picture?
The first picture, the before picture, was 225.
And you are?
150.
And how long ago was that picture?
That was about 5.5 months ago.
Wow. That is truly amazing.
Yes.
Show us the others that we have. When you look at that, what do you say?
Oh,
You must say something in your mind.
I'm so very thankful.
Yeah.
I am. I didn't see myself like that before, but looking at the before and after pictures, you know, you can really see the difference when you compare the two.
Yeah.
And
what else have we got? Wow. Christina,
Yes.
talk to me.
Like she said, I didn't see myself that way, nor did my family, but pictures don't lie. And that's just, to me, I feel so blessed.
I want you to be honest with me.
Sure.
How would you have felt, and tell me if people have said this to you, Dr. Eric, if one of your family members had said, you need to get help? Would you have listened?
Absolutely.
Really?
Yes, absolutely. One particular family member did. My mother, she was my biggest cheerleader, and she was behind me 100% and agreed that something needed to be done, you know, so I proceeded with it, and I would do it 1,000 times over.
Dr. Eric, when you hear something like that, how do you think is the right approach to say to a friend or a loved one, hey, I think it's time? Because it's such a personal question.
Absolutely, but I think you can't lose sight of the fact that it's a disease. You know, if someone's blood pressure is out of control and they're ended up in the ER with chest pain, or they've had a stroke, no one would think twice about sitting down with that person, family member, and saying, if you don't do something, you're going to die. And for some reason, because it's a disease that we wear on the outside, that we're afraid to be honest with people and say, if you don't do something, it's a disease. It's classified as a disease, and it's not 100% self-inflicted. And people need to stop thinking that and saying that. And so, you know, I tell them from the beginning, look, I'm always going to be honest with you. And so if you're struggling, if 6 months into it they weren't doing what they're doing right now because they weren't putting in the work, I'm going to be honest with them. But there's a right way and a wrong way to do that. And, you know, when I tell them when you pick a surgery program and a team, you have to find somebody that you feel like you can be honest with. You know, or if you're afraid someone's going to belittle you or tear you down, there's a good chance you're not going to show up for follow-up, and you're just going to hide if you mess up. And they need to have that comfort level that they're going to be able to approach somebody and say, look, I'm struggling. If it was easy, they wouldn't have come see me in the first place.
I got you.
Yes.
He's pretty amazing, isn't
Yes.
he?
Yes.
Very much so.
His team is really great.
Yes.
The hospital is amazing as
Yes.
well.
Yes.
All right, we're going to come back.